Hello everybody, welcome. Today we have joining me Dr. Lamberty, who is an OBGYN. Welcome.
Thank you, Dr. Sadiki.
Give us a little bit of a background of who you are and what you do.
Sure, yeah. So, my name is Norman Lamberty. I was born in New York and grew up in the island of Puerto Rico. I am married and I have two very young boys, very talented boys. After Puerto Rico, we joined the military and we were stationed in Okinawa. We lived in Okinawa for about 3 years. And my passion was always to become a physician. And my family helped me tremendously in this journey. And eventually, after the military, we moved to Washington, D.C. And I went to medical school at Georgetown University. I feel like, and I tell everyone that my entire family graduated with me. My wife was a big part of studies in Georgetown, and so were my kids. After Georgetown, I did my residency in Orlando. Orlando, Florida. I did a community health program that was very, very, very busy, and I specialized there in high-risk obstetrics and minimal invasive surgery. But again, family was so supportive there that I feel like Anna, my wife, graduated with me from residency.
So let's talk about why you chose OB.
That's a real nice story. I mentioned Okinawa, Japan, and our first child. My wife was pregnant for, I thought, way too long, and I think she was 42 weeks when she finally went in labor. She was in labor for 25 hours. We had gone back and forth to the hospital, and at this point, she went from trying the natural birth to getting medication to finally this baby was coming. And Dr. Cody, a military doctor, was ready to basically supervise a natural vaginal delivery. There was a resident with us. You know, I had the scissors in my hand so I could cut the cord, and all of a sudden he noticed that Norman Jr. was in danger, and it was amazing how he took over that part and just wrapped his hand around my hand and cut the cord and grabbed the resident that was there and had her take care of Anna, and then grabbed me again and pulled me to another corner. The pediatrician wasn't around, so we resuscitated our baby. That inspired me to do OBGYN.
That's an incredible story. Let's talk about a little bit of the challenges you faced, going through medical school and residency and having a family,
Absolutely. Maintaining a balance is easy to say, but it's sometimes very difficult to accomplish. And when you're in the middle of something like a quest, like medical school, and you feel like if you miss out on that one lecture, if you miss out on that one tiny subject, you don't know the entire subject, you could miss the entire question. You tend to overdo it, and that's a big part of the challenge, trying to balance your life between your family and yourself and medical school and medicine. You always have to take care of yourself. When you stop taking care of yourself, you can't take care of others, and you can't take care of medicine. And so that's a huge part of keeping that balance.
Okay. Talking about balance, so you worked during medical school and residency. Tell us a little bit about that, because I feel like I'm in residency and I can just barely keep up. So how did you manage to take care of your family, go to residency, and then maintain a job?
Wow,
that's amazing.
Thank you. I appreciate it. I think we all do what we need to do to survive. I think.
Absolutely.
By the time I started medical school, we had 2 boys, in 1997. Joshua was 5 and Norman was 10. And my wife and I both worked outside to be able to support ourselves. And we couldn't afford to stop working completely and leave on loans. So I was so fortunate that during that very first year of medical school, my job offer to keep me employed. And so I went from a salary position and supervisory management position of a computer center to a consultant. And so they gave me a pager, they gave me a cell phone, which at the time was huge, and I would answer calls. And I had a team of technicians that would go around the building, repairing computers, installing something, solving some problems, doing a help desk. And at that point, I was the most experienced one of those persons, and they always came to me for help. So I kept that. I went to school. On my way back home, I would stop at work and work for about an hour or two, and then come home. It actually worked out because in DC, the commuting is so terrible that if I were to go home directly from medical school, it would have taken me a couple of
That same
hours.
amount of time.
So yeah, instead of being on the road, I feel like I just spent that time in the office. Yeah, and that really was great for the first year. In residency, my wife and I became a really good team, and she coordinated all these physical exams after I acquired my license. And sometimes I do remember being post call or being on a night float where I was working only nights, and she would pick me up after checkout in the morning, and I'd go to sleep in the car, and she'd go drive to houses. She would do all the interviews of the patients, fill out most of the form, and then come back to the car and wake me up so that I could do the EKG and do the phlebotomy and finish the exam. So yeah, it's a challenge, but when you're in the middle of it, you think that that's just the next thing that you have to do.
Mm-hmm.
If you have to do it, you have to do it.
Absolutely.
Mm-hmm.
So talking about these challenges, have you experienced burnt out, or have you had others that you've noticed, in residency or even during practice that they've experienced being burnt out? And how do you avoid that?
It is part of the same thing.
Mm-hmm.
It's part of the same thing. We are very we're most of the time we're overachievers.
Yeah.
As physicians, and we tend to not know when to stop.
Mm-hmm.
And when you're dedicated to the profession, you wake up early, you go to bed late, you don't eat your 3 meals a day.
Sometimes you have to pick between eating, sleeping, or showering.
It's very true. It's very true. And so you stop taking care of yourself, and you don't even realize. When you're in the middle of it, you don't realize that you're doing that. You think that you have a balanced life. I mean, you still go to dinner. You still, every once in a while you do something else, and so, but it accumulates,
Mm-hmm.
and that lack of sleep accumulates. That lack of sharing with others accumulates. That socializing with your family, with your friends, really accumulates, and then all of a sudden you feel like you just can't do it anymore. And I think many of us experience that. The main thing the main advice that I can give doctors, students, future doctors about burnout is that they have to take care of themselves.
Mm-hmm.
Their body and their mind is first. And so if you find a way, you have to find a way to do something that you like on a daily basis.
Mm-hmm.
You have to find a way to share with your family, with your loved ones at least on a daily basis.
Yeah.
Okay?
Like, to have an emotional outlet. For example, first year of residency for me was very difficult, dealing with patient death, dealing with very difficult patients. So there would be days where I'd go home and talk on the phone with my brother or my mom or one of my friends and just talk about what my day was, what happened throughout my day. And I feel like that helped me de-stress.
Yes.
So even if it's a little bit of a thing, but to not just bottle up those emotions, because it can be quite daunting to have to deal with that all by yourself.
not to stop doing the things that you like.
Yeah.
So in addition to venting,
Mhm.
sharing with that family member, if you're a biker, go bike.
Even if it's like for 5 minutes,
Even if it's
just
5
make
minutes.
that time.
Break the routine,
Yes.
okay? And you become more efficient.
Mhm.
You become more efficient at studying. You realize that you have to break the day in many pieces.
Yeah.
And that's part of avoiding burnout.
Absolutely. That's beautifully stated. Okay, let's talk about, so we tackled a lot of difficult concepts, so let's talk about advice. Things
Sure.
that you would share, given all this, years of experience and everything that you've gone through. What would be your advice to pre-med or medical students who want to pursue what you're doing to become an OBGYN and to excel like yourself?
Thank you. Yes, so first of all, I think being an OBGYN is part of it is a calling. I mean, you get called out to do this beautiful vocation that I practice, and you get placed in this very, very good position to bring life to the world. So I think that's it's really an honor for me to have been placed there. Now after saying that, for medical students, for kids that are thinking about going into medicine, the most important piece of advice that I can give you is that you should learn what practicing medicine is like.
Mhm.
A lot of times we think of, I want to be a cardiologist, I want to be an orthopedic surgeon, but we really don't know
Mhm.
what it's like to live that on a daily basis. Even in medical school, I didn't know what it was like to become an OBGYN, to become a cardiologist. It took shadowing a doctor.
Mhm.
So my piece of advice for all students, all doctors in training, is to try to live that profession through someone else, shadowing someone else, before selecting your specialty. And the one that really calls out to you, that you can say that I'm gonna enjoy this even when I'm very tired and haven't slept in appropriately in days. That's the one.
it, yeah.
That's the one for
Yeah.
you.
No, I think that's incredible advice. So growing up, I always thought I was going to be a surgeon, to the point that until the late third year of medical school, when I was, doing sub-Is, I thought I was going to go into surgery. So to think about it, that, I love surgery, I love hands-on, but I did 5 months of sub-internships where you as a medical student will act like you're a resident so that you
Right.
can apply to residency programs. And it opened up my eyes because, talking about it, even shadowing was one thing, but to kind of immerse myself in the field, I noted that I'm not made to be a surgeon. I loved a lot of aspects of it, but there were certain things that it showed me that, I want continuity of care, and it made me realize that I liked everything, so I couldn't just dedicate myself to just surgery. So I think that's really good advice, to put yourself in that person's shoes, that specialty, and to really figure out, is this for me? Is this a calling? And I think the way I ended up in family medicine, it truly is a calling for me. I love being able to not just have that continuity of care, but also be a doctor that my patients can keep coming back to me, and I can teach, and I can still do procedures.
Yes.
So I think it takes time and it takes dedication, but you should never, you should always keep an open mind.
Definitely.
Yeah.
Definitely. And it's funny that you say that story, because I have an opposite story that happened to me in medical school. I thought I always wanted to be a cardiologist.
Mhm.
And I thought internal medicine was first, and then cardiology.
Yeah.
And within those internships, I realized, everybody told me that I had great hands to become a surgeon. And then, so I like procedures, I like to do things.
Yeah.
And I didn't realize until then that I'm truly, truly a doer.
Yeah.
I have to be doing something all the time. And so my profession as an OBGYN, I get some of that continuity of care.
Yeah.
I get families to come in while I'm taking care of the patient for their prenatal care, or towards the end of life, during reproduction and after reproduction. But I'm constantly doing something. And so, and that's so important for me. Of the OBGYN specialty, doing surgeries, it's what really one of the things that calls out to me. So yeah, it's funny that you say that because it's so true that your mind gets so open by your experiences during those internships.
Absolutely. Well, thank you so much for giving us your valuable time. I hope you guys enjoyed this video, and we'll be continuing to make more videos, so stay tuned.
Thank you, Dr. Sabi.
Thank you.